Mirabegron is one of the medication that is indicated for the treatment of overactive bladder. This medication is a beta-3 adrenergic receptor agonist that can reduce contractions of the bladder and it produces relaxation of the bladder. This relieves the symptoms of overactive bladder. In this video, let's cover the important key facts about this medication. First of all, let us see what is Mirabegron. Mirabegron is a beta-3 adrenergic receptor agonist. Here we can find the suffix begron. We have few of the other drugs with similar suffix like Vibegron, which is also classified as beta-3 receptor agonist. Both of these drugs are having the same suffix begron. Here, what is the suffix begron indicates? The letters B indicates it is acting on the beta-3 adrenergic receptors, and ON indicates they are acting like agonist. So begron is a beta-3 receptor agonist which include Mirabegron and Vibegron. Both of these medications can be used in the treatment of overactive bladder. These medications can produce a direct relaxation of the bladder which improve the symptoms of OAB. What happens in the overactive bladder? This is a condition where people may have a sudden feeling of urination. They may have urinary urgency and they are unable to control their urination. They may also have increased frequency of urination, and in such people, urination may occur more than 8 times per day, and particularly this urination is more frequent during the night. This may disturb the sleep and this condition may be called nocturia. In the children, it may also lead to the bedwetting and they may have at least 2 times urination during the night. Urinary incontinence is another important symptom of this condition that results in the leakage of urine. Overactive bladder may be due to any problems in the muscles or nerves supplying to the bladder. In the people, the detrusor muscle may contract involuntarily that results in the increased frequency of urination as well as increased urinary urgency. The neurons supplying to this bladder may also more stimulated, resulting in the increased bladder contractions. People with any previous history of stroke, spinal cord injury, or multiple sclerosis may also have neurological disorders that results in loss of bladder control. In a few people, excessive fluid intake may also result in the increased frequency of urination, and sometimes inadequate intake of fluids can also irritate the bladder, resulting in more number of contractions. Presence of infections, bladder stones can also result in OAB. In the adults, high intake of caffeine, alcohol, or chronic constipation can also result in the development of overactive bladder. This overactive bladder may be present both in the adults as well as in the children. That's why bladder relaxants are essential to treat this condition. And among them, Mirabegron is one of the medication which is acting like a beta-3 receptor agonist. Now let us see how this Mirabegron works in treating overactive bladder. Normally, adrenergic receptors can be classified into 2 types, alpha adrenergic receptors and beta adrenergic receptors. These beta adrenergic receptors are of 3 types: beta-1, beta-2 and beta-3. Beta-1 receptors are mainly expressed on the heart where they respond for cardiac contraction. Beta-2 receptors are present on the different types of smooth muscles where they produce relaxation. And finally, beta-3 receptors are expressed in few locations. Among them, bladder detrusor muscle is one of the location which is specifically expressed with beta-3 receptors. Now, Mirabegron is selectively acting on these beta-3 receptors, resulting in bladder relaxation. Normally, beta-3 adrenergic receptors on the detrusor muscle are mainly responsible for relaxation of the bladder muscle. When mediators like norepinephrine are released, they can act on the beta-3 receptors that results in the activation of adenylyl cyclase system. When this adenylyl cyclase system is activated, it results in the release of cyclic AMP. Cyclic AMP plays an important role in producing the contraction of the cardiac muscle, but at the same time it produces relaxation of the smooth muscles. So here in the bladder, cyclic AMP levels are elevated, which results in the inactivation of MLCK, myosin light chain kinases. These are the phosphorylating enzymes which are required for contractile mechanism. Now, elevated levels of cyclic AMP can inactivate the MLCK that results in inhibition of contraction. This produces relaxation of the bladder. In this way, norepinephrine and epinephrine can produce bladder relaxation. Now, Mirabegron is a selective beta 3 receptor agonist. Therefore, it can activate these beta 3 receptors, resulting in increased cyclic AMP levels in the detrusor muscle. This produces bladder relaxation that improves the filling capacity. Therefore, it reduces the urinary urgency and it also reduces bladder contractions. This helps in decreasing urinary frequency as well as urinary urgency. This also improves urinary incontinence as bladder can fill more volume of urine due to relaxation. In this way, Mirabegron relieves the symptoms of overactive bladder. Now let us the precautions of this medication. Mirabegron can increase the blood pressure. Therefore, blood pressure should be periodically monitored. Particularly in the people with pre-existing hypertension, this medication should be carefully used. The increase in the blood pressure is more pronounced in the children with ages 3 to 12 years. And particularly in people with systolic blood pressure above 180 millimeters of mercury and diastolic blood pressure above 110 millimeters of mercury, use of Mirabegron is not recommended. Mirabegron is metabolized in the liver. Particularly, it can be metabolized by two important enzymes, CYP2D6 and CYP3A4. And particularly, this medication can act as a moderate inhibitor of CYP2D6 enzyme. Therefore, when this Mirabegron is given with other medications, it can produce few drug interactions. Particularly, when it is given with digoxin, the levels of digoxin are elevated, which may produce increased risk of toxicity. Since digoxin is having a narrow therapeutic window, Mirabegron should be carefully given with digoxin. And this increase in the levels of digoxin may be more pronounced when Mirabegron is combined with other medications like sulfasalazine. Sulfasalazine is a anticholinergic agent which also acts as bladder relaxant. In people with severe overactive bladder, Mirabegron may be combined with sulfasalazine. In such combinations, the levels of digoxin may be elevated when it is co-administered with these medications. Similarly, when Mirabegron is combined with few other medications which are metabolized by CYP2D6, their metabolism may be interfered as Mirabegron acts as a CYP2D6 inhibitor. Therefore, their levels may be elevated in the body that needs a dosage adjustment. Particularly for medications with narrow therapeutic index, the dose should be properly adjusted while taking with Mirabegron. When Mirabegron is combined with antimuscarinic agents, it may produce a significant effect on the bladder relaxation. Since antimuscarinic agents can also produce bladder relaxation, combining Mirabegron with antimuscarinic agents may produce urinary retention. This urinary retention may be more pronounced in people with bladder outlet obstruction. Therefore, in such people, it should be carefully given with antimuscarinic agents. Now let us see the side effects of this medication. One of the important side effects of this medication is the elevation in the blood pressure. Particularly in people with pre-existing hypertension, this effect is more pronounced. Therefore, careful monitoring is required on the blood pressure while taking Mirabegron. In children with age 3 to 17 years, use of Mirabegron may increase urinary tract infections. Apart from these, this medication can produce few other side effects like dry mouth, joint pains, dizziness, constipation, and nasopharyngitis. It can also produce palpitations along with elevation in the blood pressure. In people with eye disorders, Mirabegron should be carefully used as it may increase the risk of intraocular pressure and it may produce some blurred vision. That's when people with glaucoma, this medication should be carefully used. Even this medication can increase the dyspepsia and abdominal distension in people with gastrointestinal disorders. Mirabegron is metabolized in the liver and excreted in the kidneys. Therefore, this medication should be carefully used in people with any hepatic and kidney impairment. Now let us see doses of this medication. Mirabegron can be taken either with or without food. However, in the children, it is recommended that this medication should be taken along with food to reduce the risk of sudden increase in the heart rate. Mirabegron is available as extended release tablets. These tablets are available at two strengths such as 25 mg and 50 mg. From these tablets, medication is slowly released for an extended period of time. That's why these tablets should not be crushed, chewed, and they should be swallowed as whole with plain glass of water. It is also available as a solution for pediatric purpose, where it is available at 8 mg per ml, suitable for reconstitution. For the treatment of overactive bladder, it can be started at a dose of 25 mg per day, and it can show its effect within 8 weeks of the treatment. However, in people with insufficient response, the dose may be increased to 50 mg per day. Mirabegron can also be combined with muscarinic antagonists. In such conditions, 25 mg of Mirabegron may be combined with 5 mg of sulfenacin succinate. This combination is given once a day. In people with renal impairment, the dose may be adjusted, particularly when the glomerular filtration rate is less than 30 ml per minute. The maximum dose of Mirabegron is 25 mg per day. Similarly, in people with moderate hepatic impairment, the dose should not be increased above 25 mg per day. However, in severe cases of hepatic impairment, this medication is not recommended. So that's all about the different facts of Mirabegron. Mirabegron is used to treat overactive bladder, where it can be used either alone to improve the symptoms like urinary urgency, urinary frequency, and urinary incontinence. It can produce bladder relaxation by acting on the beta-3 adrenergic receptors. However, this medication can increase the blood pressure, so a frequent monitoring of blood pressure is required, particularly in the children. When it is combined with muscarinic antagonists, it may improve the efficacy by producing more significant bladder relaxation, but at the same time, it may increase the risk of urinary retention. Mirabegron may interact with few other medications like digoxin and other medications which are metabolized by CYP2D6. So that's all about this medication, Mirabegron. I hope this video is useful to you. If you really like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thanks for watching. See you in the next video.